What if I told you your blood pressure reading might be completely wrong? Not slightly wrong, dangerously wrong, wrong enough to make a healthy person look seriously ill. And worse, this mistake is so common that most people do it every single time without realizing it. It can add 20, 30, even 40 points to your reading. That means you could be labeled as having high blood pressure when you're actually fine, or the opposite. Today, you'll discover the one simple mistake that could be putting your health at risk right now. After 20 years working with heart patients, I've seen both sides of this problem. People taking medication they never needed and suffering from dizziness, falls, even injuries, and others ignoring real high blood pressure until it turns into stroke, heart attack, or kidney failure. Both are dangerous, and the difference between them comes down to one thing: knowing whether your blood pressure reading is real or fake. By the end of this video, you'll know exactly how to tell the difference. Let me tell you about Robert. He was 71, active, healthy. He felt completely fine. During a routine checkup, his blood pressure was measured. 158/94. High. They checked again. Even higher. His doctor didn't hesitate. You need medication. Robert was confused. He had no symptoms, but he trusted the numbers. He started taking the pills. Within days, he felt dizzy, unstable, like the ground was moving under his feet. Weeks passed. It got worse. He couldn't walk confidently. He stopped going outside. Then one day, he fell down the stairs. Head injury, brain bleeding, emergency surgery. His life changed forever. Here's the shocking truth. Robert never had high blood pressure. His readings were fake. A simple mistake. Added over 30 points every time he was tested. If you want to know what that mistake is, comment 1 below. Because what happened to Robert could happen to anyone. Now here's what makes this even more disturbing. Robert didn't make a rare mistake. He made a common one. In fact, most people do it every single day. At home, at the clinic, even at pharmacies. And no one corrects it. Not the nurse, not the doctor, not the machine, because it looks normal. But this tiny detail can completely change your blood pressure reading. And it all comes down to one simple thing: your arm position. Let me tell you about Margaret. She was 73. Her doctor said her blood pressure was high, but she didn't want medication. So she decided to check at home. And the numbers looked normal. 125, 130. Never too high. She felt relieved. It's just stress at the clinic, she thought. Months passed. Everything seemed fine. Until one evening, her hand went numb. She couldn't speak clearly. Her face started to droop. It was a stroke. A severe one. She survived, but lost her independence. Here's what happened. Margaret's blood pressure was actually high, but her home readings were fake low. She was making the same mistake as Robert, just in the opposite direction. And that mistake cost her everything. So what's the mistake? It's not the machine. It's not your doctor. It's something much simpler. Your arm position. Where your arm is during the measurement can change your reading by 20, 30, even 40 points. If your arm is too low, gravity pulls blood downward. The reading goes up, fake high. If your arm is too high, pressure drops. The reading goes down, fake low, just a few inches. Makes a huge difference. That means you could be diagnosed with high blood pressure when you're actually normal. Or worse, you think you're safe when you're not. All because Your arm was in the wrong place. Here's why this happens. Blood pressure is the force of blood against your artery walls, and it's affected by gravity. When your arm is below heart level, blood pools downward. That increases pressure at the measurement point, so the number goes up. When your arm is above heart level, gravity works the opposite way. Pressure drops, so the number looks lower. Even a small height difference can shift your reading by several points. That's why accurate positioning is not optional. It's essential. Let me show you how powerful this is. One patient measured her blood pressure 3 times within minutes. Same person, same machine. First, her arm was hanging down. The reading was high. Then, she placed her arm at heart level. The reading dropped. Finally, she raised her arm above heart level. Now the reading looked normal. 3 positions, 3 different results, a difference of over 30 points. Nothing changed except her arm. This is why so many people are confused, because the numbers change, but the mistake stays hidden. So how do you measure correctly? Follow this exactly. Sit in a proper chair, back supported, feet flat on the floor, not crossed, not hanging. Rest quietly for 5 minutes. No talking, no phone, no distractions. Let your body fully relax. Place the cuff on your bare upper arm, not over clothing. Make sure it fits properly. Now, the most important part. Rest your arm at heart level. Exactly heart level. Not lower, not higher. Use a table, a pillow, or even books to adjust the height. The middle of your arm should align with the center of your chest. Stay still. Don't talk. Don't move. Take the first reading. Wait 2 minutes. Take a second reading. Wait again. Take a third. Write all 3 down. Then average them. That average is your real blood pressure, not the first number, not a random check. Consistency matters. If you want accurate health decisions, you need accurate numbers. And this is how you get them. Now let me tell you about Thomas. He checked his blood pressure at home every day, and it always looked fine. 128, 132, 135. Nothing alarming, so he believed. He was under control. But there was a problem. He was measuring the wrong way. His arm was slightly elevated, and he only took 1 reading each time. When we measured it correctly, 3 times, arm at heart level, his real number was much higher, 165 over 96, dangerously high. His headaches suddenly made sense. Thomas thought he was safe. He wasn't. If you've ever trusted just 1 reading at home, comment 1 below, because this mistake is more common than you think. Arm position is the biggest factor, but it's not the only one. Many small habits can quietly change your blood pressure reading. Caffeine, for example, a cup of coffee can raise your pressure for up to an hour. If you measure too soon, your reading will be higher than normal. Smoking does the same. Nicotine tightens blood vessels. Pressure spikes quickly. Exercise is another factor. If you just walked, climbed stairs, or moved around, your blood pressure is temporarily elevated. You need time to return to baseline. Even your bladder matters. A full bladder can increase pressure by 10 to 15 points. Talking also raises blood pressure. Even casual conversation can push the number higher. Posture matters too. If your back is not supported, your body works harder to stay upright. Pressure increases. Crossing your legs restricts blood flow. That alone can shift your reading. And cuff size, if it's too small, your result will look higher than it really is. All these factors add up. Some push your number up, some pull it down. The result? A reading that doesn't reflect your real health. That's why accuracy is everything. Let me tell you about Patricia. She thought she was doing everything right, checking every morning, writing down her numbers. But she drank coffee before measuring. She sat without back support. Her arm was below heart level, and she only took one reading. Each mistake seemed small, but together they created completely unreliable results. She believed her blood pressure was under control. It wasn't. When measured correctly, her numbers were higher. This is how multiple small mistakes can lead to one big wrong decision. If you're serious about your health, you need to measure your blood pressure the right way every time. Start with a reliable device. Choose a validated monitor, one that's clinically tested. Make sure the cuff size fits your arm. Too small, your reading goes up. Too large, it may drop. Pick a consistent time. Each day, morning is best. Before food. Before medication. After your body has fully woken up. Create a routine. Same chair, same position, same conditions. Because consistency creates accuracy, and accuracy creates better decisions. This isn't just about numbers. It's about knowing what's really happening inside your body. But what if your home readings and doctor readings don't match? Which one is real? There's one way to know for sure. 2 4-hour monitoring. You wear a device for a full day. It measures your blood pressure every 20 to 30 minutes, day and night. No guessing. No one-time readings. Just real data from your daily life. This removes stress effects and technique errors. It shows your true average. If there's confusion, this is the answer. Because when it comes to your health, you don't want opinions. You want the truth. 2 patients, same situation, different outcomes. Susan had high readings at the clinic, but normal readings at home. 2 4-hour monitoring confirmed the truth. Her blood pressure was normal. She didn't need medication. Now James, same pattern. High at the clinic, normal at home. But his results told a different story. His real blood pressure was high. His home readings were wrong. Same confusion, different reality. That's why you can't rely on guesswork. Only accurate measurement leads to the right decision. Your blood pressure is not just a number. It's a decision that can affect your entire life. Measure it wrong, and everything goes wrong. Measure it right, and you protect your future. Now you know the mistake. Now you know how to fix it. If this helped you, comment 1 below, because that one action might remind you to never make this mistake again, and it might even save your life.